Good afternoon, ladies and gentlemen. Welcome to your health program, You and Health Ed on Equinoxe Radio, Multimedia, and for presentation, I am Esie Lucy Lengu. It is a highly contagious infectious disease caused by microbacterium. It primarily affects the lungs, but also can impact other parts of our bodies or other organs of our bodies, including our kidneys, spine, and brain. Sure, you have guessed the topic for the day. Today, we'll be looking at tuberculosis and also how it can be prevented and why not the causes of this pathology. With me here in the studio is our special guest. She's not other person than Dr. Glory BEFEKE ANYE. She is a general practitioner but also the medical officer at St. John's Memorial Clinic here in the city of Douala. Good afternoon, doctor. You're welcome to the program.
Thank you so much, Lucy. Good afternoon.
Good afternoon. Always a pleasure having
you.
And straight away, we'll start with our questions, doctor. We'd like to know, what is tuberculosis all about?
Tuberculosis, as you already mentioned, is a contagious bacterial infection. It is caused by the Mycobacterium tuberculosis, and its primary site is usually pulmonary. That means it affects primarily the lungs. And when it affects the lungs, we term it pulmonary tuberculosis. It can also affect other parts of the body, as you've rightly announced, such as you announced, the kidneys, the spine, and all of that. And once this happens, we call it extrapulmonary tuberculosis.
And we know that recently on the 24th of March, Cameroon joined the world to observe the World Tuberculosis Day. It is a pathology still in Cameroon, just like HIV, that is really affecting thousands of people in our country. What are the common symptoms of this condition?
Right. We have a persistent cough that sometimes may last for 2 to 3 weeks. Then you can have someone spitting up blood or sputum. Sputum is that kind of thick mucus or a thick substance that one coughs out. We equally have a night sweat, then tiredness, chest pain, sometimes fever, fatigue, and many others that can be associated with it.
If you're just joining us now, you're just tuning into your radio or TV set, you are onto the program You and Health Ed on Equinoxe Radio Multimedia. And if you have your questions with respect to the program tuberculosis, we have the following numbers: 670-547049. I repeat, 670-547049. Or you can reach us via 656-62-2222, 656-62-2222 at the end. And back to you, doctor. Who is more at risk of contacting or the disease tuberculosis?
We have those with a weakened immune system, especially those with the HIV virus. It presents to them in the form of an opportunistic disease. Equally, we have those health practitioners, health workers in the health units that do not practice some preventive measures. Sometimes they are exposed. We equally have those who live with those in the active stage of pulmonary tuberculosis, in direct contact with such infected persons. These equally are directly involved. We have those who live in overcrowded areas or in areas that are less ventilated, like those in the prisons, are equally exposed to contracting the tuberculosis disease. Also, those who are malnourished or those who suffer from some chronic diseases like diabetes as well are exposed to this disease.
And now, those who live, we know that in Douala or in our major cities, we have had cases of poor waste disposal. Can this waste also lead to this condition, to tuberculosis?
Right. Waste on its own will not, but if there is a specimen or the sample in the form of sputum, because those are some of the ways through which it is transmitted, if sputum is rejected and deposited on this waste, yes, it is. Now it's about hygiene. The poor hygienic conditions will equally favor or speed up the rate of transmission of tuberculosis.
Who are those more likely to be exposed? When we come to those who are vulnerable, we have women, we have children, and also have the elderly. Who among these people are more exposed to tuberculosis?
All these persons are at high risk. For the children, once they are exposed, the tuberculosis disease is rapidly spread. And sometimes it gets so difficult to diagnose tuberculosis in children. For instance, we do not have some of the very specific signs like cough, like sputum. We may have maybe bloody urine, which may be equally an indication of kidney tuberculosis. So in children, it makes it a little bit difficult for this diagnosis because most of the symptoms are extra pulmonary. For the pregnant women, it can lead to low birth weights of babies or babies born preterm. For the elderly, it can be confusing with some diseases that are attacked with aging. For instance, like back pain, that we can say no, the back pain or rheumatoid arthritis is normal for the old, but we have the extra pulmonary tuberculosis, which is manifested, which can be manifested by back pain, which is due to maybe a spinal tuberculosis. So at old age, it can be very confusing. And once this happens, it can lead to some other severe complications.
And at what age should we begin to worry that we should visit the hospital? Is it when we start coughing a lot, or we have some of these symptoms that you mentioned? At what stage should we visit the hospital?
Now, once we have someone around us with persistent cough, the close contacts should quickly contact the hospital, because sometimes those who cough, they may take it like it's just a normal cough. You know, in our environment, we'll say, oh, it's dust, or it's cold,
it's seasonal.
Seasonal. You know, but once the cough starts persisting to like 2 weeks, you have a cough that is persisting up to 2 weeks, 3 weeks, it's a call for concern that you have to do some medical checks.
Now, let's talk about the available treatment options in our country. What are some of the treatment options available to treat those who are suffering from this condition?
Right. We have drugs that are sensitive to tuberculosis. These drugs, or those who have this sensitive form of tuberculosis that can be sensitive to the drugs, their treatment option can go on for like 6 months, and which is composed of some 4 types of antibiotics. We have what we call the rifampicin. Medical personnel to understand when I speak like this. We have equally what we call isoniazid. We have pyrimetazine. We equally have entabuzole. So we have some compositions, 4 of them in number, that can be used on the sensitive form of tuberculosis or the active form. Now we equally have those forms that are resisting to treatment. Those ones we use the second line of treatment, and it can last. The duration can go on for like 9 to 24 months.
We also know that most medics, mostly on the 24th of March, equally raised the problem of patients or children not being injected or take the TB vaccine ahead of time. We have a call on the line. Hello.
Hello, good afternoon, sir.
Good afternoon, sir. Your name and where you're calling us from?
I'm Mungo Vitalia.
All right, your question.
Yeah, I heard a doctor say a while ago that if somebody is vomiting blood continuously and maybe accompanied with cough, that can be symptoms of tuberculosis. I also want to know the case of maybe somebody who gets up in the morning and maybe when he's about to brush his or her teeth, and that blood is coming out and without being accompanied with cough. I don't know if they can be also qualified as symptoms of tuberculosis.
All right, thank you for your question, sir. You got him?
Yes. There is a difference between gingivitis, because that condition of brushing of the teeth, and you have blood oozing. it's an infection of the gums or the gingivitis. That is a different situation. When we talk about the symptoms of tuberculosis, there should be coughing, especially the active or the pulmonary tuberculosis. There should be a cough. The cough that can go on for like 2 weeks to 3 weeks, and the cough should one should be coughing up either this blood. Blood, yes, is a sign of other symptoms, maybe lung cancer, and maybe, well, that's what we call hemoptysis. Hemoptysis, that means you are coughing out blood. It's different from vomiting. Vomiting, hematemesis, we call, when you vomit out blood, is hematemesis, but when you cough out blood, is what we call hemoptysis. It should be coming from the lungs, and once it's coming from the lungs as a differential, tuberculosis should be a diagnosis.
And that's more reason why people should go to the hospital, right?
Right.
So in order to ensure that to differentiate the various conditions. And we were talking about the TB vaccine to prevent the disease.
Right. From infancy, we have the Bacillus calmette-guerin, which is the BCG. It's administered right from birth, and it gives some protection against the tuberculosis disease. Now, as methods of prevention, we can use the BCG, which is one of the principal ways from infancy. Also, early detection and early treatment will also help to curb down this disease.
But does it mean that when you are being, let me say, injected from small, at the long run, when you get old or when you grow up, when you go in contact or you get in contact with someone who is infected with tuberculosis, are you not going to contact the disease? It's
possible. That's why there should be the normal routine. For instance, one who coughs out, you should have the routine of protecting yourself from inhaling whatever microbe that is rejected, because over time one's immune system gets weakened. And once immune system gets weakened, it may be through diseases like the diabetes we had earlier said, HIV, one never knows, or other diseases, one gets prone, although you had received the vaccine at infancy, but one gets prone to contracting this disease.
Let's talk about the side effects of the TB medications. Are there other ways in which we can manage these side effects?
Now, the 4 molecules for the active phase, the pulmonary tuberculosis, can cause what we call hepatotoxicity. It's a kind of liver damage. It can also lead to vomiting, nausea or vomiting, especially the pyrazinamide can cause joint pain. And there's one other molecule, the entamizole, can cause visual disturbances. So the liver function test, regular controls, checks should be done in the hospital. So once one starts taking these medications, any side effects, be they allergies, be they whatever, one needs to contact his or her healthcare professional, where the management will be done. The liver function test will be done. Then one needs to stay hydrated, needs to eat very well before taking the medications in order to reduce some of these side effects.
Doc, I do know whether those listening to us or watching are worried or asking the question, but how can we reduce this disease, or how can we curb this disease by some measures? What are the measures to be implemented?
Right. The wearing of face mask, especially for those already in the active phase of the pulmonary tuberculosis, one should carry on the mask. The close contacts, those who are around such who is already infected, should equally protect themselves and not to get so close in order to inhale this disease. Equally, we should learn to ventilate our living spaces, because once the Mycobacterium tuberculosis gets in an environment where it's overcrowded or poorly ventilated, it can easily cause the infection to whoever comes in contact with the one.
Now, this disease is mostly considered as contagious by many, and we will have the stigma around anyone who is suffering from this condition. Mostly when you cough, they'll be like, hey, don't cough beside me, don't do this. So how can someone who is suffering from tuberculosis manage this stigma?
Right. That's why Equinoxe is here. Equinoxe is giving the sensitization to the public, for this stigma to go away. It's true that it comes with the stigma of shame, isolation.
Yeah.
We will tell, well, to equally prevent the other seemingly healthy individuals, in order that not everyone should contract the disease, there should be this form of isolation, protection, but it should not be done in a form of stigma or stigmatizing the individual. So a lot of public awareness, sensitization, education should continue, just like what Equinoxe is doing.
And those around you, how do they manage the condition when you have someone who is sick of tuberculosis? Are you supposed to wear a face mask beside them? Are you supposed to avoid any close contacts with them?
No. The one who is sick should carry on a face mask.
Okay.
It needs to be explained to the one. The one needs to understand that this condition is contagious. It's not like to make the one feel mean or feel bad, but that's the truth about the mode of transmission of this infection. So those around this person should make sure that the one always carries a face mask, and contacts, it's not like we should isolate the one, but we should do that through prevention. Yes.
Any
people to around should carry on the face mask and equally go to hospital for early diagnosis.
All right. Any last words for those listening and viewing?
Yes, please. The staff at the St. John's Memorial Clinic and the patients, we are greeting you and say that we join in this sensitization campaign with Equinoxe in sensitizing the population in order to reduce the stigma of the tuberculosis.
Thank you very much, Dr. Glory BEFEKE ANYE, for honoring our invitation.
Thank you so much.
And thank you, ladies and gentlemen, for presentation. I have been Esie Lucy Lengu. We have come to the end of your program. You heard on Equinoxe Radio Multimedia. At the technical dashboard, we had Bertrand Bonzoni and Jonathan Babiola. We live in the company of interesting programs. Do have a nice day.